Good evening, everyone. This is Dr. Rostenberg from Beyond MTHFR. And tonight I'm just going to bring you a short to the point video talking about the coronavirus, the COVID-19 virus that's basically, sweeping the world, bringing in all kinds of uncertainty, fear, and kind of some negative thinking out there. And maybe it's justified. I'm not saying ignore everything, but I just want to give you an understanding of why vitamins matter. Okay. What's the best way to survive this? Is it to have a truckload of toilet paper and Lysol disinfectant wipes stored away in your crawl space? Maybe, but I think I have a better idea. I have an idea based on the science of how viruses work and how our immune system protects itself from these kind of infections. Those of you that have followed our work for some time, you're well aware of what's called the methylation cycle. This is basically the bottom half of it. This is called the transsulfuration cycle. It simply shows how our body takes a sulfur molecule like homocysteine, which was derived from our diet, from eating protein, animal protein, plant protein, methionine, basically the amino acid methionine. And this sulfur-containing molecule is then converted through a series of chemical reactions into the most important antioxidant in our body, which we call glutathione. Glutathione is made in every single cell of our body, and it has to be there or we will suffer some severe and potentially life-threatening consequences. So the question of why do vitamins matter? Do you need a face mask to prevent getting the virus? In fact, the face mask is actually supposed to be used by the people who have the virus. What I'm believing in is science of our antioxidant system and how our immune system takes care of infections. Let me say something else. This might seem a little controversial, but bear with me, it'll make sense. When you get an infection like COVID-19, when you get sepsis, when you get some other serious upper respiratory infection like SARS or a bacterial pneumonia, what actually kills you is not the infection itself. It's what your body does to try to get rid of the infection that will hurt you and potentially kill you. Let me explain. You have an Army, an Air Force, a Navy, a Coast Guard, you have SWAT teams, you have Marines. Your body has all these tools to go out and clean yourself up. It's called your white blood cells. And they use their own versions of napalm, laser-guided missiles, tanks, foot soldiers, etc. They use tools to kill things at a cellular level. These vitamins, zinc, selenium, and vitamin C, are so important for our immune system because without zinc, selenium, and vitamin C, as you can see on this chart, our body will basically be forced to fight an infection naked. And fighting an infection naked means you might kill some of the enemy. But in fact, as soon as you start dropping bombs and calling in airstrikes and sending in the foot soldiers, your own army will die because they don't have any protection. And if there isn't enough antioxidants to protect your army, there's certainly not enough antioxidants to protect the healthy cells that live next to and among the cells that are infected. So what happens to those cells as the infection rages on is as this virus spreads and your immune system recognizes it and attacks it, a massive amount of inflammation is generated. As this inflammation progresses and builds up, the damage begins to happen to the cells that are actually healthy. Okay? We have healthy cells in there, folks. We have our immune system. We don't want them to be destroyed. So without these antioxidants being produced, without glutathione being produced, because we have a deficiency of zinc, selenium, and vitamin C, we will suffer much longer with the infection, and it will lead to much more severe and serious side effects of any infection, especially of the COVID-19. So imagine what it would be like if your system ran out of vitamin C. Mammals like many mammals, most of them can make vitamin C from scratch. Humans can't, and a couple other mammals like bats and gerbils. So if we run out of vitamin C, all of a sudden, if you look at this chart, we can't recycle our glutathione and turn it back into a useful molecule. We're left with this oxidized glutathione that already soaked up a free radical, but if vitamin C is available, vitamin C can take the free radical away and turn on glutathione and recycle it over and over and over and over and over again. That's what we want. We want glutathione to do its job very, very rapidly and effectively. And this is why in the research that you'll see, zinc, selenium, is shown over and over again to improve the immune system, to help fight infections. There's nothing magical about zinc and selenium. And it's not some hocus pocus, nutrition stuff that's trying to make a claim that isn't backed up by science. When you look at this chart, it will tell you how it works. Zinc and selenium, right here, are your cofactors required to synthesize and produce glutathione. Just that simple. Once glutathione is produced, vitamin C is necessary to recycle it and make it last as long as the expiration date says. Whether that's 2 hours or 10 hours, I don't know. But if the glutathione only lasts 1 second and then it's useless, then you're in trouble. That's why we're promoting in our practice, and as we help guide people, we want to see people load up on zinc, selenium, vitamin C. Vitamin D is another one, and there's herbs and mushrooms I'm not going to talk about yet that support the white blood cells themselves, just helps them work more effectively. This is why nutrition matters. I've always been a person asking why, kind of maybe annoying at some point, always asking why, how does it work, why, how does it work, and through a lot of study and research, here's the simplest way I can explain it. When people say zinc is good for the common cold, or make sure you take selenium and you won't get sick this year, this is the reason why. Now you know. It promotes the production of glutathione. Glutathione is the most important antioxidant. Once glutathione is made, vitamin C is also needed here to keep it working, keep the shield up, keep the armor up. And if you give your immune system good armor, and you give your healthy cells good fire extinguishers, your body can fight the infection and it won't kill you. What's happening to people is their immune system is doing what it's supposed to do. It's fighting more and more aggressively as the infection spreads, but because their tissues can't protect themselves, the healthy tissues are getting destroyed. The immune system cells are having high casualties, so they're weakening, and it's putting this massive stress on this patient. And if it's happening in the lungs, you start to destroy the small tissues, the real thin, delicate tissues of the lung, and they start to leak fluid. And you basically begin to drown in your own, inflammatory inflammation. It fills up in your lungs and you're in real respiratory distress. You have a severe problem, life-threatening. So that's the reason why. As far as the science goes, I'm just going to share a few of these. This came out not even 4 months ago, showing that zinc supplementation improves the length of time that someone has pneumonia. And remember, everybody who gets SARS or the swine flu or coronavirus or even suffers from scurvy, a lack of vitamin C, they all die of pneumonia at the end of the day. So there's a connection between scurvy, a lack of vitamin C, and dying from respiratory viruses, because respiratory viruses, from the inflammation that they produce, consume all your vitamin C and use it up, trying to recycle glutathione. That's just how the science works. You can change how much vitamin C you have in your body. You can take more zinc, you can take more selenium. And in a world full of bad news and just all the stress and craziness that's going on out there, I always have to go find something that I can control just to calm myself down, right? Something cathartic. So I can control how much zinc, selenium, and vitamin C I put in my body. And hey, by the way, I'm helping you guys figure that out too. So this is pretty brand new data on that. Zinc supplementation improved clinical symptoms in children with pneumonia. This is really fresh, hot off the presses. This is from February 13th, 2020, not even a month ago, and this is published by the Journal of Medical Virology, major, virus research journal. So they have something of an insight into how this virus works. Now, this is their language, not mine, literally word for word. If you have zinc deficiency, it results in a dysfunction of your immune system. The combination of zinc and pyrithione at low concentrations inhibits the replication of coronavirus. Okay, so zinc, just having zinc in your body inhibits the virus from replicating. Therefore, zinc supplementation may have effect not only on the COVID-19 related symptoms like diarrhea and the pneumonia, right? We're talking about that, but also on the virus itself, the COVID-19 itself. So that's pretty strong language. Do you think you need zinc? If you had to choose between a truckload of toilet paper and a few bottles of zinc, you guys know what I'm going to say, right? You go for the zinc first. This is data on selenium showing in a chart basically how this works. when you have enough zinc, you get what's called a Th1 response from your immune system. And that type of Th1 response is where your body is really like a sniper. It's able to go out and kill all the virus-infected cells very, very quickly and effectively. And your macrophages over here are in a anti-inflammatory state. They're not blowing up the healthy cells. They're not destroying the immune cells. It's like this is the best way to wage this battle. But it's only possible when you have enough selenium. And this came out in 2015, but it says here super nutritional selenium intake, which means high doses above the RDA level, was shown to favor T cells towards the Th1 version and macrophages towards the M2. Basically what I just told you, but that's the most optimum outcome. If you don't have enough selenium, what happens is the cells that are actually supposed to kill the virus, they don't do a good job of that. They try to fight it in the bloodstream rather than find the infected cell and kill it before it replicates. And then your macrophages end up acting like a bull in a china shop and just start breaking stuff and destroying your healthy cells. That creates inflammation, that makes it hard to breathe, and that puts your life at risk. Just that simple. If you damage your lungs with inflammation from your own immune system fighting the virus, and your body doesn't have the fire extinguishers and the armor to protect itself, you get in trouble. This is a little older study, but it says right here, if selenium deficiency is left unchecked, hyperoxidation disrupts biomolecules. Now I highlighted that because it's just telling us what the story is. They're saying without selenium, you don't get enough glutathione produced. Your immune system is bringing the hammer down on this virus. It's creating all kinds of free radicals, using everything in its arsenal to kill this virus because that's its job. But if you're low in zinc, low in selenium, and low in vitamin C, that fighting the virus is going to destroy your own tissues. It's the same reason why people who get sepsis end up with multiple organ failure. It's not because a bacteria invades every organ in their system. It's because they get an infection so bad, like in their gut or their toe or some other infected area, that the infection releases all these chemicals to try to kill the bacteria. And those dead bodies and all that inflammation floods into the rest of your system and like creates inflammation everywhere else. So just keep that in mind. It's not the infection per se, it's what your body does to fight it. Now I just happen to want to check, the curious person that I am, what the selenium deficiency situation is in China. Now I'm not an expert in Chinese geography, but the red dot's about approximately where Wuhan is in the Hubei province. And you can see that while, they're saying here that Wuhan is sort of in the normal selenium area, who knows if in China, where most of their food is grown, if it's grown in a selenium poor area and that sort of thing. And so you can look up the same charts for zinc, really any vitamin, and you can start to see that certain countries are a lot more supplemented and robust than other countries. So is this the reason why it started in this part of the world? I don't know. This is the area where I guess my opinion is going to be that this is the area where the virus was geoengineered and released, and the fact that it spread so fast may have something to do with their low selenium intake. And that's just straight out of the journal Nature. All right, so I got maybe one more thing to show you here. This is, as I bring it to a close, I just wanted to share with you, I have a new short article here on my website. You go to protocols at beyondmthfr.com and you scroll down to Corona 101. Coronavirus 101. It's just a brief little overview of what I shared with you. It has some ideas in here on supplementation that we're recommending to our patients. It's a crazy world out there. There's a lot of fear and a lot of uncertainty. Everything you can do to take control of that and to have some tools you can use, like different types of vitamin C. We have vitamin C for little kids who can chew stuff. There's powdered vitamin C for babies and adults, or tablets for those of you who want to use tablets. We use really high quality companies. They work great. Liposomal vitamin C, is it more effective than oral, like powdered or tablets? I haven't really seen the data on that. All I can say is it costs more, and you get more bang for your buck if you go with a buffered, powdered vitamin C, that kind of thing. So I appreciate you guys listening. I'll check the comments. I know this is a big topic. It's probably not going to go away in the next few weeks. We're going to be dealing with this, the fallout from this for a while. So hopefully that helps explain a little bit about how viruses make you sick and what you can do and with you and your loved ones to protect yourselves. Thanks so much and have a great night. Bye-bye.